Hello doctors, today let us continue with the previous video. So in last class we had discussed regarding the diseases of external ear. So now we are going to discuss regarding the diseases of middle ear. If possible, we will continue with the inner ear also. Just 1 minute. So tell me what are all the parts of middle ear which we had already discussed. So there are three parts. One is tympanic cavity, which is none other than the middle ear. And then comes eustachian tube. And regarding eustachian tube, we had already discussed there was a disease condition called patellus eustachian tube, which is associated with pregnancy. And the third part of medial ear is mastoid air cells or mastoid antrum, we can say. So today the discussion will be mostly around these three different parts of middle ear. So let's start our discussion. We will not be discussing in detail. We will be discussing mainly the MCQ point of view in that particular disease condition, because in case of ENT, the marks weightage will be very less for MCQ purpose. So first, the disease which we are going to discuss is secretory otitis media. First point, we should know what are the other name of the secretory otitis media, that is blue ear. Then comes serous otitis media, and then otitis media with effusion. So these are all the other name for secretory otitis media. Okay. So then, and why it is happening? So here the main problem is with eustachian dysfunction. This dysfunction may be due to lot of reasons such as nasopharyngeal issues such as nasopharyngitis or any problem associated with adenoids and tonsils. This eustachian tube dysfunction may occur. So already we discussed that what is the main function of eustachian tube. It connects the nasopharynx and the middle ear cavity, and it maintains the pressure changes. Okay, it maintains the pressure changes in the middle ear along with the pressure changes in the environment. So here what happens, because of the problem with the eustachian tube, there will be collection of fluid. Okay, that will lead to the collection of fluid, and this collection of fluid literally leads to hearing loss. Okay, so this is how patient will be presenting, and there will be hearing loss, and fullness will also be there. Fullness of ear also the patient will be complaining of. And in addition to that, so if a patient is coming and complaining of all these things, literally we will go for otoscopy, that is for sure. So on otoscopic examination, there will be increased fluid levels behind the tympanic membrane. So behind the tympanic membrane, let me show you how it occurs. So for example, this is the otoscopy through which we are viewing the ear. So here comes the external auditory meatus, and then there will be tympanic membrane. Okay, so this is the tympanic membrane, and from here middle ear cavity starts. So here if we are watching from here, and already I told there will be collection of fluid in the middle ear. So it will be like behind the tympanic membrane there will be increased fluid level. So this is the presentation in case of otoscopy. Okay. And at last, the gold standard investigation. What could be the gold standard investigation for this particular disease condition? It is none other than pneumatic otoscopy. Pneumatic otoscopy. So here it is secretory otitis media, which is also called as blue ear, serous otitis media or otitis media with effusion, and it's because of the eustachian tube dysfunction leading because of nasopharyngitis and some other any other condition associated such as adenoids or tonsils. And here the main function of eustachian tube in general is to maintain the pressure changes between the outside environment and middle ear. So whenever there is any dysfunction, that will lead to collection of fluid, and this collection of fluid will lead to hearing loss and fullness of ear. And on otoscopic examination, there will be increased fluid level behind the tympanic membrane. Yes, it is sure, and the golden standard investigation is of pneumatic otoscopy. So let's move on to the next disease condition. So the next condition is acute mastoiditis. So here in case of acute mastoiditis, it mainly appears as a sequel, that is a continuation of acute otitis media. So whenever there is any acute otitis media, the most common complication will be of acute mastoiditis, and mainly in children age group. So generally, if there is any inflammation in the mastoid, what are all the things we can expect? There will be fever, sure. Then comes the retroauricular pain, that is pain behind the ear. Retroauricular pain. Then comes sagging of skin of posterior superior wall. Sagging of posterior superior meatus. That is external auditory canal. There will be this issue. Sagging, that is none other than flaccid. Then ironing out mastoid. We can see this, and tenderness over the mastoid, and along with that there will be one important sign, that is pulsatile discharge, which is also called as lighthouse effect. Pulsatile discharge from the ear, lighthouse effect. So try to remember this in case of acute mastoiditis. This pulsatile discharge is more important. And then we are moving towards the next condition. So now we are going to discuss one important practical MCQ. If you might have gone in flight, you might have experienced this condition, that is otitic barotrauma. So whenever there is any pressure changes, that may lead to this otitic barotrauma. So here this mainly happens during descent. So descent, while we are flying in the flight, if there is any descent, like whenever we are reaching the destination, there we can experience this otitic barotrauma. Sometimes we used to have severe earache, which I had also experienced severe earache few episodes, and sometimes there may be hearing loss also. And then there might be tinnitus also. So these are all the common symptoms, and most commonly we will be experiencing the severe earache once we will descend, and we can use the Valsalva maneuver to get rid of this otitic barotrauma, and things will be okay. So most commonly this symptom we can see, that is severe earache. Then yeah. Now we are moving towards the broad classification of diseases. You all might be knowing, that is AS, OM and CSOM. So first our topic of discussion is ASOM. So here the most common people getting affected were children, And then the most common organism is Streptococcus pneumonia. So as in previous class also I had told, you should note this most common causative organism in order to avoid the confusion at last moment. And there are few stages of ASOM. First is the stage of tubal occlusion. And then comes the second stage, that is none other than pre-suppuration. Then the third stage will be suppuration. And the fourth stage will be resolution. And then in case of tubal occlusion, there will be no fever, and there we can expect loss of cone of light, which we can see in tympanic membrane, that will not be seen here. Then comes pre-suppuration. There will be congestion of tympanic membrane, and there is some special appearance of tympanic membrane, that is cartwheel appearance of tympanic membrane, that you should know. And regarding the suppurative stage, there are two different signs which we should know. One is nipple sign and the second one is lighthouse sign. Okay. So in case of resolution, what happens? At the end of acute suppurative otitis media, the tympanic membrane gets ruptured and the middle ear gets dried and finally healing occurs. So this is how the resolution stage occurs. So tubal occlusion, there will be no fever and loss of cone of light. So you should know the location of cone of light in the tympanic membrane. That is more important MCQ. Pre-suppuration stage, the tympanic membrane will be appearing like a cartwheel. And in case of suppuration stage, there are two different signs. One is nipple sign and another one is lighthouse sign. So if the resolution occurs, the tympanic membrane ruptures and the middle ear gets dries and healing takes place. Okay. So this is all regarding the acute otitis media. Sorry, acute suppurative otitis media. Then one more MCQ related point. When you will call a condition a recurrent otitis media. So there are two different definitions. Definitions, it's not a definition, it's just for your idea. So if there is 3 episodes or attacks or bouts, whatever it is, 3 episodes of ASOM in 6 months and 4 to 5 episodes of ASOM in 1 year. So this is the definition, so this is the criteria for naming a condition as recurrent otitis media. So now we are moving towards the CSOM, that is chronic suppurative otitis media, which is a more important clinical entity in our homeopathy clinics. So you should have a good idea regarding it. If the condition is of more than 3 months, then it is chronic suppurative otitis media. And here the most common organism is Pseudomonas aeruginosa. Okay. So this is the causative organism where we can see in malignant otitis externa also the same organism is the common cause. And here in case of CSOM, there are two different types. One is safe type and unsafe type. So safe is none other than tubotympanic CSOM. Tubotympanic. And this unsafe one is of Attico-antral perforation. So here, in case of safe CSOM, the perforation will be in center, and here in case of attico-antral, it will be of marginal CSOM. Okay, sorry, marginal perforation we can see. And here one of the important effects. So in case of safe or tubotympanic CSOM, we have one different effect which is called as a round window shielding effect. So what it is, like what will happen? So in case of tubotympanic disease, patient says some paradoxic, that is some opposite effect. So let's see what is the opposite effects seen here. It is whenever there is discharge, like increase in discharge, hearing is good. So normally whenever there is discharge in the ear, our hearing will be very bad. Okay, there will be reduction or impairment in hearing. But here in case of safe for tubotympanic CSOM, patient says a paradoxic effect, that is increase in discharge leads along with good hearing. So this is called as, this is mainly due to round window shielding effect. This you should have some idea what it is. Next. So next, regarding the pathology, we are discussing the pathology to continue with one interesting condition of ear. So now it's regarding the pathology of unsafe ear or attico-antral type. Okay. So what are all the pathological conditions we can see here? First comes steatoma. You might be knowing the name confirm, and this is the interesting condition which we will be discussing later. And then the second pathology is articular necrosis. We know in middle ear we have the article chain, so we may expect the articular necrosis, and the most common is seen in the incus. And the third pathology which we can expect is cholesterol granuloma. And at last we can expect osteitis, that is none other than inflammation of bone. So these are all the pathological conditions we can see in case of attico-antral CSOM. So now let us pass on to the condition polysteatoma in detail. Okay. So basically what we will think by looking at the name, it is like a choly and steat. We may think that they are related to fat or lipid or cholesterol, whatever it may be. And by looking at the woma, we may think it is somewhat related to tumor. So this is our idea regarding by just looking at the name. But one thing that we have to know is that this has nothing to do with fat and tumor. So these type of things which has nothing to do with the name of their own is called as misnomer. Okay, so they are inappropriately named, misnamed. Okay, so let's see exactly what it is. So cholesteatoma is none other than the collection of keratinized squamous epithelium. Keratinized squamous epithelium in middle ear or mastoid. Okay. So simple, where we can see the keratinized squamous epithelium, it is seen in the skin. So our skin is made up of keratinized squamous epithelium. So it is none other than skin in wrong place. So you are now clear that the skin in wrong place has nothing to do with this cholesteatoma. That's why it is called as misnomer. And here we may see this in two another conditions that were sclerotic mastoid, if the sclerosis is mastoid is undergoing the sclerosis, and epidermal inclusion cyst. And in case of epidermal inclusion cyst. So this is all regarding the cholesteatoma. And here one interesting thing, that the most common site of cholesteatoma. So simply there are three different types of tymphanum: epitymphanum, mesotymphanum and hypotymphanum. So here cholesteatoma is seen in posterior epitymphanum. Okay, so this is all regarding the cholesteatoma. So let's move on further. I think you are understanding. If there is any doubt, kindly convey to me. And now we are moving towards the complications of otitis media. So here there are two different complications. One is intratemporal and another one is extracranial. Okay. So here in case of intratemporal, we can expect mastoid inflammation, then petrositis, that is petrous bone inflammation, then we can expect facial paralysis, and at last we can expect labyrinthitis. So here labyrinthitis, there are two different types of labyrinth: bony labyrinth and membranous labyrinth, and there is inflammation, then it is labyrinthitis. In case of extracranial, we can expect different types of abscesses. Abscesses may be of extradural, subdural, and then brain abscess. And the second condition, an extra abscess, is meningitis, and then lateral sinus thrombosis, and then at last otitic hydrocephalus. So these are all the major complications of otitis media, and few more MCQs related to it. Most common complication of acute otitis media, that is another than acute mastoiditis, and then comes the next most common intracranial complication of acute otitis media and CSOM is meningitis, and the most common extracranial complication of CSOM is also acute mastoiditis. So these are all the important MCQs you should know regarding one. So next, And already regarding acute mastitis, we had a good discussion. So I'm just recalling it again. It is most commonly accompanied or followed by acute suppurative otitis media or acute otitis media. And here the most common organism we had not discussed before, that is beta hemolytic streptococcus. So this is the causative organism causing this acute otitis media. Acute mastitis. And here signs already we discussed: mastoid tenderness along with swelling. And we discussed regarding this pulsatile ear discharge, which is also called as lighthouse effect. This we had just now discussed. And then sagging of postero-superior hiatal wall, that we had discussed. And then perforation of tympanic membrane and conductive hearing loss in case of acute mastoiditis. So these are all the discussion points which we already seen. Next, we are moving towards the subperiosteal abscess. So in case of subperiosteal abscess, there are different types of abscesses. First, we will go with the most common type, that is postauricular. That is posterior to the auricle or ear. Postauricular is the most common type of subperiosteal abscess, and there are few named abscess. I am just mentioning the name and you should know the location of it, nothing more in detail. So first is Luck abscess, which we can see between the mastoid antrum and external auditory meatus. And then comes Bezold abscess, which is related to sternocleidomastoid muscle. Okay, sternocleidomastoid muscle. And another only one abscess, that is Sittelli abscess, which is seen in the digastric triangle. Okay, this we can see in digastric triangle, Sittelli's abscess. Okay, so this is all regarding the subperiosteal abscesses. Now moving forward. So now we are going to discuss one important syndrome, Grady-Nego syndrome. So syndrome is none other than the collection of different disease conditions. So what we can see in case of Grady-Nego syndrome, this is one of the important MCQ. A deep temporal headache we can see, and then we can see retroorbital pain, that is pain behind the eye. Then comes diplopia, which is associated with fourth cranial nerve paralysis. Okay, so this is Grady-Nego's syndrome. So now we are moving towards the next condition, that is sigmoid sinus thrombosis or lateral sinus thrombosis. Let me write. So here one interesting thing we can discuss, it's regarding the type of fever in this thrombosis. And there is a named fever which we may expect in MCQ, that is Picket fence fever. So Picket fence fever, it is nothing but hectic rise of temperature, like there will be sudden rise of temperature along with rigor. So why it is happening? So it is because that there will be periodic release of hemolytic streptococcus leading to bacteremia. So if our blood is loaded with bacteria suddenly, then that will lead to the rise in temperature leading to picket fence fever. So here one more interesting thing named sign which you should know is MT delta sign. Okay, MT delta sign. This we can see in case of contrast enhanced CACT, that is contrast computed tomography, which is one of the investigation of choice. Investigation of choice for the sigmoid sinus thrombosis. So this is all regarding the sigmoid sinus thrombosis. So moving further. Just 1 minute. Now tubercular otitis media. So whenever tubercular otitis media is coming out, I always think about the appearance of tympanic membrane, which we had already discussed, and it is seen in our materia medica also. That is none other than multiple perforations. Multiple perforations will be there. Okay. So here, and this tubercular otitis media is most commonly secondary to pulmonary TB. The patient who suffers from pulmonary TB gets this tubercular otitis media, and then it is most commonly seen in children and young adults. And here we may find severe conductive deafness, and then facial palsy, which is the common complication. Okay, this is the common complication of tubercular otitis media. Okay, so now we are moving towards the next condition, that is otosclerosis. There is some important um, symptomatology related to this otosclerosis. Let me explain you. First, this is an autosomal dominant condition, and there will be family history of deafness, and this condition is most commonly associated with South Indians and whites. And one important correlation with pregnancy is an aggravation factor for this otosclerosis. And here the most common site of predilection of this otosclerosis is lobuli interossi, which is seen in the temporal bone. So don't get confused, it's not in somewhere else. By looking at the name, don't get, it is seen in the temporal bone only. And here, most important MCQ, this is the most common cause of conductive deafness, that is non-suppurative conductive deafness in adult. Okay, so this is one of the important MCQ, so kindly remember it. And here what type of presentation we can see: progressive conductive deafness, that too bilateral, and there will be tinnitus. Okay, so this is how the presentation will be. And then the important symptomatology which I was saying from before, that is para-accusis villi. So here what happens, the patient hears better in noisy surroundings. I think in calendula it was mentioned that patient hears while traveling in a train, something like that. So here it is also similar. Paracusis villi, patient hears better in the noisy surroundings. So this is the important and very strange symptom of otosclerosis. And this otosclerosis is seen in one syndrome. Let me tell you the syndrome name, that is Van der Hoeve syndrome. And here what are all the things we can see? Otosclerosis, blue sclera, and then at last pathologic bone fractures or Paget's disease we can expect in this syndrome. So this is all regarding the diseases of middle ear, and in next class we will be continuing with the diseases of inner ear. And thank you so much, and continue just to revise before starting the next video. Thank you.